Good morning, good afternoon, or good evening, everyone. Welcome to this Yale Center Beijing event with Yale Professor Frank Snowden. My name is Carol Lee Rafferty. I'm Yale College class of 2000 and also the managing director of Yale Center Beijing. Tonight, I'm joined by, of course, Professor Frank Snowden, as well as our moderators, Devin Lau, and also Helen Wu, who will start our Q&A session. Just a quick word, because this is a very intimate discussion, we would encourage all of you to turn on your cameras to the extent your conditions allow. We've had almost 100 of these online events, and we're very delighted to be collaborating with alumni clubs around the region, such as those in Shanghai, Hong Kong, Singapore, India, to run these lovely, wonderful events for us to be able to feel a sense of community as part of Yale, and to be able to have intellectual discussions during these unusual times. I know Devin will give a more comprehensive introduction about Professor Snowden's very important work. I am especially delighted to have Devin as a lead moderator today, because he is a history major at Yale College, class of 2009, Timothy Dwight College. And I'm also very delighted to have Helen Wu as a co-moderator. She was an intern at Yale Center Beijing and a high school student, an 11th grader at the Shanghai High School International Division. She did a fantastic job watching Professor Snowden's entire Open Yale course, and did a fantastic summary and review of the course, which had a lot of readership on our social media accounts. So without further ado, I'm gonna turn the podium to Devin, Professor Snowden, and Helen later. Thank you.
All right. Thank you so much, Carol. Hello, my name is Devin Lau. As Carol mentioned, I am class of 2009, and I'm the assistant director for Yale Center Beijing. And as Carol mentioned, we've been hosting a series of talks really since basically the pandemic started. And we've covered a lot of ground, everything from sleep habits during quarantine to the racial tensions in the US to music. So we've really covered the whole gamut, and it's hard to imagine we're almost coming up on a year since COVID first started in China. And so we thought it would be a good time to look back on the year, as well as just to put this pandemic in the context of the history of different epidemics. And so today, we're particularly delighted to have Professor Frank Snowden join us. Professor Frank Snowden is the Andrew Downey Orrick Professor Emeritus of History and History of Medicine at Yale. He's a graduate of Harvard and Oxford, and he's, of course, the author of Epidemics and Society, From the Black Death to the Present, which was the #1 recommended book by the World Economic Forum to read for context on the coronavirus outbreak. That book, of course, was based on his very popular Open Yale course, Epidemics in Western Society since 1600. And so we're going to be going through a lot of that content in a moderated discussion format. And that's what I'll do is I'll start off with some questions for Professor Snowden. And then at about the 45-minute mark or so, I'll be opening it up to questions. So if you do have questions, keep them ready, and then we'll get into a more free-flowing discussion then. So just by way of starting, I wanted to say that Professor Snowden was actually in Italy doing research, as I understand, on epidemics when the coronavirus outbreak really hit Italy. And so kind of coming full circle there on doing research on epidemics and then being in the middle of one in Italy himself. And so we'll definitely be able to ask him about that experience as well. So welcome, Professor Snowden.
Oh, thank you very much. I'm delighted to be here with you.
All right, so let's get started. I think for most people before this year, no one was really thinking about epidemics. We were all just sort of living our normal lives, and nobody really paid attention to public health. But of course, that's not the case for you. You've been studying epidemics for a long time, years, decades even, thinking about epidemics and the impact that they have on people and society and history. So I guess as a way of introducing yourself, the first question is, how exactly did you become interested in this topic of the history of epidemics? And how did you get started studying this?
I guess I would say, in answer to that, probably two different things led me in this direction. One was a personal experience, because that always counts, and the other is an intellectual one. The personal one was that in 1973, distant time now, I was a PhD student working in Rome, Italy. And at that time, there was an outbreak in Asiatic cholera that struck Naples and Rome in particular. And I remember the fact that there was a lot of tension in the city of Rome, and I saw cars with Naples license plates being pelted with stones. And I remember going to the marketplace, and people who were selling goods were being attacked by crowds in the city. And then this Italy at this time was the world's seventh industrial power. And it was very striking that the prime minister and the minister of health came onto the television and reassured the population of Italy that actually they had nothing to worry about, because the Vibrio that causes Asiatic cholera is exquisitely sensitive to acid. So all you need to do is go out and buy a couple of lemons and squeeze the juice on your raw muscles, and you're good to go. Now, if you believe that, you'll believe anything. And I think this was followed up by the same two figures went to the infectious disease hospital in Naples and visited the cholera patients. Incidentally, at a later, not too many years later, I went to the same hospital and went through their records for this particular outbreak. But in any case, the point was that there they were in the ward, and a local newspaper caught a magnificent little video clip of them sort of trotting down the aisle between the beds, because they were rather frightened to be there. And both of them had their fingers clasped like this behind their backs, because that in Italian popular culture is the way to ward off the evil eye. So I was thinking, what does this show? This really shows a lot about a society, its beliefs, its priorities, all sorts of things like that. And it's really very interesting. I'd love the opportunity to understand that more deeply. And then I came instead down the path of doing social and political history. And at that point, I began to read, though, in part of the research about medical events in times of epidemics past. And I began to be distracted enormously, because they seemed to show really a great deal about the society in which they occurred. And I came to hold the belief that this was an ideal lens, and really to examine what people's living conditions are, what their social, political, and economic relationships are. And this led me to, in fact, plunge headfirst into the history of epidemics and their effects. And I've come to believe what I just said to you much more even than I did then. I think, in fact, that if you look at a pandemic like the one we're living through, it really is like watching a moral drama, with the bright and the dark sides of human nature being exposed there in front of us. Or to change the metaphor, we could say it's rather like having a mirror in which we see ourselves reflected. That is to say that these events are not random. There is, of course, contingency. Anyone can be at the wrong place at the wrong time. But in aggregate, I would say that societies create pathways that microbes exploit to make their way through our midst. And each society or level of development of society is different and is therefore susceptible to different epidemic diseases. So this conviction became stronger and stronger, and that's really been part of the fascination of many of the years of my life.
All right, that's great. And I'm sure we'll have plenty of time to get into more detail into how exactly epidemics are a mirror into society. I also wanted to, we talked a little bit about your personal experience with COVID and how you were actually in the field researching in Italy when everything sort of started going crazy in Italy in particular. And it became a full-blown, it went from an epidemic in China to a full-blown pandemic around the world. And so, in fact, when I first reached out to you, I think this was probably in April or May, it took a while for us to connect because you were actually sick with COVID and trying to get back to the US. So what was that experience like, having studied epidemics for so long, but then all of a sudden you were, doing your research and then you were actually in the middle of the pandemic, in the middle of getting this sickness and catching COVID?
No, well, the first thing I obviously would say is that it's not something I really recommend anyone to get COVID-19. So that would be a first point. But I would say that one of the things that happened to me is that I was like everyone else in the world, in that my life plans for the year were entirely upended by this event. I went to Italy because I wanted to do research on something completely different, which was the role of Pope Pius XII on the onset of the Cold War in Italy. Pope Pius XII being the Italian Pope who was there as Pope during the World War II and the Holocaust and the early post-war years. And it's only very recently, in fact, in 2020, that his papers have been made available to scholars. So I thought I would be spending the spring and a bit of the summer in the archives of the Vatican. That was quite a mistaken assumption on my part. I got to Rome and it was a bit odd because I had written that it was very likely that there would be an epidemic of a viral disease in the not too distant future, a claim for which I don't claim great originality because virologists have been making it since 1997. And so it's not something that I happened upon all by myself, but I did feel that there were lots of ways in which I could watch the world systematically unpreparing itself to face an event of that kind. And so I wrote about that. And so it was particularly odd for me to have everything that I had considered important sort of colliding in front of my face. My interest in Italian history, my interest in epidemic diseases, and then my own health. I've not gone back to the Vatican. In fact, you can't at the moment, but I've devoted myself to COVID-19 and found that I suppose actually having contracted it may add a little bit to my street credibility. So let's run with that. But I think it's been not the year I expected, as I suppose everyone here this evening and morning is having a year they weren't expecting. But nonetheless, it has been, one makes the best of it, and it's been extremely interesting. And I've been very happy to devote myself to this because I think that it's tremendously important that we not forget what is happening and that we not leave the world and our own countries in the same place that they were when 2020 started, that this needs to be very, very carefully considered, the whole issue of preparedness, so that we leave to our children and grandchildren a world that's more sustainable and much, much safer. And I say that not as a matter of gloom, despair. I don't feel that. I feel that we also have a tremendous opportunity that this terrible, tragic series of events has really caught people's attention inevitably. And so this is a time when it is important to talk about the underlying significance of this, what it represents, why we were vulnerable, and those changes that we need to make. And I, for one, could easily say to you that instead of feeling gloomy, that's a task that I could sign on to in a heartbeat.
Right. So let's get into some of those particulars of what we've observed and what we can learn. I'm sure that most of us don't have that scope of history that you do in sort of understanding just how significant this time period is. So I, for one, and I think many people are rather shocked at how inadequately the U.S. And many other places have responded around the world. And actually, I recently went back and rewatched all your lectures online from your course, which was over 10 years ago. And even then you were saying, well, it's lucky that SARS and swine flu and avian flu weren't that serious because it's a great dress rehearsal and practice for the big one to come. And, that was back in the early 2000s. And yet we clearly didn't learn our lesson. And so I'm just curious why an epidemic, especially one that's of a pulmonary viral disease, has long been anticipated by virologists and epidemiologists and experts like yourself. And yet, despite such warnings, the world has in general been very unprepared for that. So what are some of the factors that you can point to into why the things have played out the way they have?
I think I would say if I were to be asked to define the leading feature of COVID-19 and why it reflects the nature of the society we are, I would say that it's the first great pandemic disease of the era of globalization. And from the point of view, by globalization, I mean our intense interconnectedness around the planet. And I would argue that in terms of many of its features, that era begins after the fall of the Berlin Wall and the fall of the Soviet Union, because we then get the creation of a single world economy that can be totally interconnected in the way that we now are. And so this interconnectedness, however, also creates serious vulnerabilities. And these were exposed by the first, I would say there's been a series of yellow warning lights. The first of these was avian flu in 1997, and that led to a number of virologists and indeed also historians and other observers to say this really is something novel and could possibly exploit the vulnerabilities of a society that's so intensely interconnected. We then had another yellow flashing light with SARS in 2003. And it was in the wake of that that the Director General of the CDC in the United States, Julie Gerberding, and Anthony Fauci, whom everyone knows now, testified before the United States Senate, and they made an interesting analogy. They said that if you live in the Caribbean, meteorologists and climate scientists can tell you that it's with a near certainty that very soon you will experience a hurricane. They can't give you the exact date or the strength of the winds, but they know that if you don't prepare, you're extraordinarily unwise. They said that this is exactly the same thing with regard to pulmonary viral diseases. And Julie Gerberding actually said that we can expect a viral pulmonary disease that's as devastating as the Spanish influenza in the not distant future. And if we don't prepare for that, we will be equally unwise, just like the person in the Caribbean who didn't prepare for the hurricane. So after that, we see further warnings of this kind: swine flu, MERS, Ebola, and I think, and other countries as well as the United States. In England, there was a commission established which produced much of the same prediction that Anthony Fauci made in 2005. This was a year or two later. And then even as late as 2019, the World Health Organization, the year before that, appointed a very distinguished international commission to examine the preparedness. The former Prime Minister of Norway was the leader of that commission. And in 2019, note the date, the report was published, and it had a very troubling title, which was A World at Risk. Now, what are these risks that were so clear? First is that we are now, one aspect of globalization is about the population that is interconnected, and we're now nearing, so demography is a major factor. First, in total numbers, we're nearly 8 billion people, and we live in enormous cities, mega cities of 10, 20, 30 million people. And this means also ever growing density of population in those centers and a rampant rate of industrialization. It also means, as a result, that we're ever more invading animal habitat. And that is a dangerous process if it's simply done haphazard, and it leads to deforestation, therefore great climate change problems, but also great disease vulnerabilities. Example, deforestation means that we destroy bat habitat, and bats are the natural reservoirs for a vast array of coronaviruses, some of which can be transmitted to human beings. And in recent decades, we have been steadily building roads into forests where bats roost, invading bat caves. And so there is this process of human beings and bats being brought into ever closer proximity and ever more frequently. And a bat, we must remember, is a wonderful animal for transmitting viruses. That is to say, they roost by the thousands and more than one species, and they're immune to the coronaviruses, so they can pass the viruses to each other and to different species of bats. And this has been going on, and it puts humanity at risk from this transmission, particularly roads going into the forest. They also allow the sale of wild animal meat in markets all over a country like China. It's called, I guess in the West, it's so often called, well, in any case, bushmeat, it can also be called game, and hunting is going off around in lots of places in the world. I don't want to say this is a particular feature of China, because it's happening all over the world, and this risk happens all over the world as well. So this relationship with the natural world is filled with risk. Then there is another feature of it, which is these dense cities also are enormously interconnected by rapid jet aircraft. And we have the movement of millions of people around the world by that. And they, with this interconnectedness, if a virus breaks out in, let's say, in Kansas in the morning, it can be in Beijing and Rome and Johannesburg in the evening. And so this is a level of risk that virologists were seeing. In other words, we are progressively creating an environment in which there will be almost inevitably increasing challenges by pulmonary viral diseases, and that those viruses, we are creating the pathways that they exploit through our cities, through our relationship with wild animals, through mass movements of people, goods, services, transportation all around the world. There are other points about the environmental. We're creating environmental vulnerabilities because for a viral disease, clearly it won't surprise anyone that having inflammations of the lungs are a vulnerability. And this is something that we are creating with immense problems of smog, that is greenhouse gases and particulate matter that are ever growing industrial lives and ever growing transport by road and engines and factories giving off these noxious chemicals and particulate matter. It's quite clear that there is a strong correlation, and mapping clearly has demonstrated that. That is to say, if China was, I think this is part of the vulnerability to China, has had very strong problems of smog in the air, and everyone knows that. This is also true where I was living in the spring, that is to say, Italy, and particularly the north of Italy, the industrial and advanced agricultural area, has this tremendous black cloud for much of the year hanging over it of poisonous gases and fine matter. And in fact, it is Lombardy, which was the second epicenter after Hubei province and Wuhan in the world of the coronavirus epidemic. That is a place that has the most intense concentration of air particulates and greenhouse gases in Europe. And they are stagnant there because this, the Po Valley in which it is located, which stretches for some, I'm inventing the figure, I'm probably wrong, but something like 800 kilometers from west to east, has it's surrounded by mountains on three sides. And so it's a bowl in which the wind doesn't disperse this material, and it sits there and is breathed in by the population. Similarly, in the United States, it's also true other parts of Europe. Madrid has terrible problems of air pollution. In the United States, if you map the pollution of the air onto the map geography of the United States, there's an enormously strong correlation between places with air pollution and vulnerability to coronavirus. So those, one could go on about globalization. I could give you examples of specifics of exactly what I mean to explain, for example, why as soon as the virus broke out in Wuhan in China, it was so likely that it would break out also in Lombardy, Milan, Cremona, Bergamo, that became the next epicenters of the disease. That was almost an inevitability. And in answer to your question, virologists had seen these weaknesses in our society, these new vulnerabilities to diseases of this kind, and were sounding the alarm. But unfortunately, we weren't listening. And from my point of view, the most poignant question raised during the course of this epidemic was that by the US President, Donald Trump, who asked the question, who could have known? And it strikes me extraordinary because everyone should have known. Even I knew. And as you say, I knew in 2010, and that's, I'm not bragging, that's simply, I was reading. And that was quite obvious that this was, we now live in a different kind of society that has very particular vulnerabilities, and microbes have no agency, but they do have the capacity to exploit the pathways that we create for them. And we have been building so many pathways, and we haven't been thinking about in any coherent, long-term, systematic way about the consequences, assuming the responsibility for what we've done.
That's, I mean, that's the connection with the environment and health and everything is so fascinating. And with this, but it's, so there are vulnerabilities, but then there are also lack of responses that we've also seen. or inadequate responses, right? And so in particular, I think of the US, even maybe you could argue in Italy in the beginning, or other places. So can we kind of let's look specifically at some of these examples, right? So I think Italy and the US are two that you're very familiar with. And then I think in comparison to, let's say, parts of Asia like China, Hong Kong, Taiwan, Southeast Asia, South Korea, who have, they've done much better at controlling it. So what accounts for, so the vulnerability is one thing, but what accounts for the discrepancy and sort of the aftermath of how it's been dealt with?
Right. The discrepancy and in the results when it does appear, after it began to appear in the world, there is this extraordinary variation in the effectiveness of responses in different countries. And I would say that there are a couple of factors that explain why certain countries did very well in terms of this disease. Some of them, it's very surprising. And I think a lot has to do with the fact that by and large, as Dr. Tedros, the Director General of the WHO, has said, there's been, since the turn of the century, we've lived in terms of public health on a regimen of feast and famine. When those yellow lights that I was mentioning flashed, at first there was a wake-up call and people responded, that is, governments responded with additional funding, drawing up plans. But as soon as that receded into the background, there was the siren call of other priorities, spending on and cutting the budgets to public health and healthcare services. And this was not just one country, unfortunately. This is really a very prevalent feature of the last couple of decades. And so the point then is that when there was this outbreak, many places had, including Italy, had decades of cutting their health systems, their healthcare systems, cutting their numbers of hospital beds. This is one of the features, I would say, also of healthcare for profit, that there was a desire to squeeze out this spare capacity because it's not profitable to have beds and equipment and personnel that aren't being utilized at that moment. So when you do have an emergency, once you've squeezed that out of the system, you can't suddenly invent healthcare workers and doctors and beds and ICUs and ventilators and PPE. And we see this happening in country after country. There were certain countries, however, that took this warning, that responded coherently to the yellow lights. And those were countries that had been scourged often repeatedly by epidemic disease and had created structures to deal with them. And if you look at those countries, I'm not trying to make a comprehensive list, but certainly South Korea was one. And that is largely related to the fact that it had experienced MERS. That had been its wake-up call, and it had decided that, yes, the virologists were right. Yes, there is a great vulnerability to this kind of disease in particular, and we must be ready to take action should it appear. And so they were. And immediately they tested, did contact tracing, all of the things that public health officials say should be done. A second example was surprising. And I can remember Dr. Tedros saying that what he was asked the question, what keeps you awake at night? And this was about March 2020. He said, what keeps me awake at night is the anxiety about what will happen when this disease reaches one of the underfunded nations of the world, resource poor nations, as in Africa. Well, what's so surprising is that resource poor countries in Africa and some cases have done so much more remarkably better. That's amazing to hear that Rwanda and Senegal responded much more effectively to COVID-19 than did Italy or the UK or the United States. And it's shown in the figures of severe disease and death. And let me give an example, and that is Senegal. Now, Senegal didn't experience Ebola in 2014, except marginally, but it's located adjacent in West Africa to the three countries that did. That is to say, Guinea, Liberia, Sierra Leone, and being so anxious in 2014, they set up a sort of emergency surveillance and response system. And when COVID-19 appeared, they immediately took decisive action, again, testing, they instituted, they closed what we would call social distancing and mask wearing, and they closed public gatherings, mosques, schools. They stopped international traffic by air. They stopped travel within the country. They also began, the prime minister went on the television and radio every day and provided citizens with information. There was a great, wonderful messaging campaign where one of the most popular singers in Senegal, a man, Yusuf Ndour, actually wrote, it's like as if Bob Dylan had been recruited in the United States to proclaim to the youth that masking and social distancing were not something that was an infringement on, and then they were dancing to this song. And other singers did as well, and they recruited artists who painted pictures of how you need to wash your hands. They put basins in public squares for people to practice hand hygiene. And so all of this was very carefully organized. And so in this country of 16 million people, they have only so far 400 deaths in Senegal, which is to say a tiny fraction of the deaths per 100,000 in population that we have in the UK or in the United States. And I think it's an extraordinary achievement for a country that has only 7 doctors per 100,000 population, but they used their resources, they took the necessary steps, and they were able to contain the disease before it created a tragedy on a huge scale. And they were also able to avoid this false dichotomy that we seem obsessed with, at least in the UK and in the US, and that is we have to have either public health or an economy that's open and functioning. And that's an entirely false dichotomy. You can't have an economy that's opening and functioning unless you first contain the disease. And Senegal and Rwanda actually provide good examples of how they contained the disease and their economies remained open. So this is, I think, a moment when I think anyone in a powerful industrial nation needs to feel a certain apprehension in thinking that if a study was done of the effectiveness of the responses of 36 countries in the world, and they were ranked in order, of the 36, the US occupied place number 31. And Senegal and New Zealand were the top 2. I think that's extraordinary. And Rwanda was way, way ahead of the UK and the United States in terms of severe illness and death. And this is because this is not mysterious. It's not a matter of luck. a part of it is luck. Their demography was favorable. It's true that Senegal, in this particular case, was fortunate to have a youthful population. That was demographic good fortune, but they were vulnerable also. And it was that they followed science and they followed the dictates of scientific public health. The institute, the Pasteur Institute in Dakar, produced enormous numbers of vaccines, and the WHO was available to help and provide assistance and guidance. So this is, I think, an interesting contrast. And so learning the lessons of those yellow lights that have been flashing shows us a really sad feature of this disease, which is to say, in my opinion, that such an extraordinary percentage of the suffering and the death was unnecessary had nations organized and practiced scientifically directed public health and brought their populations along by careful and well-engineered messaging. And that, alas, is exactly what didn't happen.
Absolutely. And we can only hope that those lessons, that we'll be humble enough to learn those lessons as a collective in society. I guess a slightly more positive note, we did see, with globalization, the ability for scientists to collaborate rather quickly, and they were willing to do that. And, we've seen organizations like the WHO sort of fulfill the niche that they were supposed to. And I know that you've sort of worked with the WHO and their think tanks in helping them to produce reports and things like that. So what was the role of the WHO supposed to play? Did it play it the way it was supposed to? And what lessons can we draw from this particular pandemic for the future? And so that's the WHO specifically. And then I think to sort of expand that to just a general question of what can governments and kind of larger entities in general learn from this pandemic?
Right. Well, I do want to be clear that I did, as you said, work with the WHO as part of its think tank in deciding that public health and epidemiology needed to include, and this was the first time in its history, to include looking at the past and learning what past experience was and what one can learn from it to help guide practice in the future. And the epidemiologists at the WHO were saying that one of the problems is that epidemiology as a discipline, as it's taught, has traditionally been more or less about emergency response. And that is playing the role of fireman, and that what actually needs to happen as well, that is important. No one wants to dismantle that. But in addition, it needs to take on the role of removing the causes that allowed the fire to happen in the first place. And so it's that the think tank I was part of, what we were thinking about and making reservations and observations is what I'm trying to say, and suggestions for the future. So that is ongoing, and that's a lesson that the WHO has learned. But I'm not an employee of the WHO, and I want to be clear that I also feel that the WHO was partially successful, but only partly, and made many mistakes during this pandemic. And I don't want to make a sort of mythology about the WHO. But let me say something very positive to begin, which is that I think when people talk about internationalism, from my point of view and perspective, microbes are the first great internationalists. And therefore, as human beings, if we're going to be able to combat them effectively, we too need to be internationalists. That is to say that part of our survival mechanism is having a strong, well staffed and skillfully staffed and well-funded WHO. One of the tragedies at the moment was the withdrawal just at the moment when the world most needed this institution. The United States withdraws from it. That seems to me a real tragedy, because why do we need this institution? We need an international response to international invasions of these microbes. Microbes do not respect walls. They don't respect national boundaries. And I think one of the saddest features of this period would be if this period in our history came to be recognized by the metaphor of the wall. And I think that that's not what we want. It's not effective, and it completely misplaces the deployment of the resources needed to make us safe. So we need a WHO to provide example, to provide skilled personnel, to be able to practice surveillance, to be able to talk to every government in the world and rally support for a coherent plan of action that it can help guide and direct. It can help move resources, ideally, from one country to another. And in the intervals when there are not major pandemic threats, they can relate to ministers of public health and prime ministers and presidents and try to persuade them about the need for funding on an ongoing, consistent, and coherent basis. That is a role, the bully pulpit, as it's sometimes said, needs to be practiced in international diplomacy. So we need an organization, not the WHO that we have, because we've underfunded it. It hasn't been staffed and organized in the way that it should be. Even its own perspective, by its own admission now, has been that of an emergency responder rather than actually thinking of something more long-term in terms of public health. So it's this other WHO that's critical to being able to deal with this response in that way. And we also need other international organizations, the European Union, which can play an enormous role in time of epidemic emergency. And it was tragic too that the European Union was fragmented and had no coherent common policy, and then come across the waters to the United States. And I guess what I saw in Italy, I'm not also going to make a mythology about Italy. Italy had a terrible experience of COVID-19, and there are many mistakes that it made. On the other hand, it was striking to someone who lived and could compare Italy, a country in the European Union, with the United States. And what I observed in Italy was that belatedly, I must say, the Prime Minister of Italy, I don't want to make him into some mystical sort of hero, because he responded late to the emergency after it was already, the genie was already out of the bottle. But once he did respond, it was in terms of really clear messaging, that rigorous lockdown, a severe lockdown that went far beyond what almost any place in the United States experienced, was imposed, and you weren't allowed to leave your home except to purchase supplies. I know China had some, obviously, a very severe response as well. In Italy, some of those measures were also applied. What was interesting was that all the political parties supported this. And also there was a consensus among public health officials that this was the right thing to do. And I remember the Prime Minister went on television and said, this is the situation, it's an emergency, and our future of our country depends on it. So mobilizing popular support and saying that we have no vaccine, we don't have effective treatments for the disease, we have only the traditional practices of public health, of distancing, quarantine, isolation, masking. And those are the measures that are needed to protect yourselves, to protect your families, your neighborhoods, your cities, and to save your country. What was extraordinary then was to see the response. In Rome, there's a newspaper called Il Messaggero, and it wrote in a sentence I'll never forget. It said, this is the first time in 3,000 years of the history of the city of Rome that the population has ever been obedient. And what was interesting about that, you could actually see for yourself before your very eyes. I went and stood in lines outside supermarkets, and you could hear the conversations, people saying, oh, this is really tough, but we're all in it together. And it's also the case, other people have had this before, maybe in the Blitz in London in World War II, it was like this also. So we have to collaborate and get through it together. And signs appeared on balconies, everything will end up okay, and so on. And there was a great deal then of compliance with what the government was calling on the people to do. It was as if I could use a musical analogy, as if you had a symphony orchestra and each player had an instrument and a score, and there was a conductor. And so you get a sound that's coherent and that you can listen to. In the United States, you get exactly the opposite. You have this extraordinary fragmentation where you have a president saying one thing, a president's advisors saying something else. Then you have 50 governors of the 50 states all contradicting each other. And then you have municipalities taking different stances, health boards and local school boards, again, or the mayor of a city, like as in New York, contradicting the governor of the state of New York, et cetera, et cetera, et cetera. And so to use the musical analogy, I guess I would say, this was imagine the situation where you had an orchestra and each player you gave a different score to play, and then you don't have a conductor and they just all start, and what you have is cacophony, chaos. And that's what I think the US response was like. So without mythologizing the Italian response, which was belated and misguided in a variety of ways, but it had one thing that the US desperately needed, and that was coherence and adherence to science and messaging with one voice.
Well, I can keep going and asking you questions forever, but I want to open it up to some of the other people who have been so patient and listening. Helen, let's start with you. If you could come up with the first question or two. And then while Helen is asking those questions, if you guys have questions, this is what we'll do is in the chat function on the bottom of your Zoom box, you can go ahead and type in your question and we'll try to get through as many of those as we can. And I'm guessing that many people will have similar questions, so I'll try to consolidate them into a single question. We already have one in the chat box. So yeah, if you guys could go ahead and do that while Helen is asking the first question. Go ahead, Helen.
Okay. So something that's worsened the damage done by COVID-19 would be probably the recent political climate and the increasing prevalence of fake news and doubting of scientific fact. Many are rejecting science in the name of anti-elitism. So what is your response to this, and how do you think we should approach people behind these thoughts, as controlling pandemics are about encouraging masses to take preventive methods?
Right. Well, Joshua Lederberg said quite some time ago, 40 years, I don't remember, but it was, the late 20th century. And he said that if one looks at the natural world, it seems extremely perilous for our species because the numbers of microbes that are infectious are practically infinite, and they evolve and multiply almost instantaneously. And we as human beings have a position in which what we really have is only our wits to protect us. I would add our wits and our capacity, if we so choose, to collaborate, because I think that's equally important. Now, the point is that in this case, that did not happen. We did not use our wits. Our wits mean using actual, that is provable scientific data, uh, uh, data-driven responses to problems of public health. And it was an extraordinary thing to hear that the Republican Party in the United States actually is one of the few parties in the world that doesn't believe in climate science, and also clearly did not believe in public health science, that this, we heard, is just the flu, or it's just a cold, or it will disappear by itself. All these sorts of things. I think what needs to happen was for an educational process. And I think this is something else that's important. There have been studies of political leadership during in the UK and in the United States, where they bring political leaders into a room and confront them with data on an evolving basis over a series of days, and problems, and how they're going to respond to those challenges. And what they found in both the United States and Britain is that statesmen and politicians know really very little about public health problems. And so part of the task, I believe, is one of education of the political leadership, commitment of the political leadership to take seriously science, to fund science, to have scientific advice listened to, heard, and followed. And that's important. And then to explain to the public that this is a dangerous situation. I think people can be responsible if their intelligence is consulted and brought to bear on the problem. I think what was happening was that the American population was being infantilized, and they were not being given truthful and accurate and coherent information. And in that sense, it's not fair to blame the public for the fact that so many people weren't willing to collaborate with the sacrifices because they didn't understand them. And they had been lied to about what their purpose was and what their effectiveness might be. So we can do much better than that. And we can and we will. And so that's the challenge that needs to happen. But one can imagine messaging that's so much more coherent. If Senegal and Rwanda can do it, why can't the advanced countries of the world do it? They were able to mobilize their artists, graffiti painters, musicians. They went on television and radio and used social media. What is wrong with us in terms of imagination that these things were not done in the United States as well?
Okay, thank you. Also, something I found incredibly interesting was your analysis of the sources of viral diseases and how many actually arise due to our invasive expansion into animal habitats, exposing ourselves to various viral illnesses. This is obviously a process driven by large forces, but what is the best approach to changing this?
Ooh, that's an interesting and important question, and I'm glad you asked it, and I'll see if I can answer. What it seems to me is there isn't a single thing that is one thing alone won't solve the problem. But a first thing is a sort of short-term thing that needs to happen, and that is surveillance. And that is something that the world pledged it would do, and after SARS, and there was a great to-do about practicing surveillance in parts of the world where spillover was likely to occur, and it didn't happen. And it happened in an inadequate way. That's important because it's important to have the sentinels posted. But beyond that, one needs to go further and remove some of the root causes. And this is a moment of crisis for our planet and for our health. And that has to do with the destruction of the environment. And that's manifested. I think it's one of the silver linings in this dark story is that there are new understandings that are emerging. And one of them is that two disciplines that are vital that have almost always been along separate tracks have now seen that they're inseparably bound together. And that is public health and environmentalism, that you really need both in the modern world, and that environmentalism is now teaching us not only that we need surveillance, but actually we need to control deforestation, that it's destroying the planet, and it's also creating enormous new problems for our health. And so that's a longer term issue that really needs to be confronted, and we need immediately to rejoin the climate, international climate regimen, and begin as the United States to be a member of the agreement and to address the whole issue of greenhouse gases and deforestation. And we see this happening all over the world, and it's happening, as everyone knows, in Africa. And this is where it's not only that it happened in China with regard to spillover from bats to human beings, and we have coronavirus, it happened in West Africa with Ebola, started in the same way with the destruction of bat habitat. And the index case was a child playing in the hollow of a tree in which thousands of bats pushed away from the canopy of the forest were roosting. And he breathed in the fumes from their droppings. And that was the index case. And DNA research has demonstrated that the other cases in Guinea all originated from this one case. And there was this sense that people had that globalization wasn't really a reality in the media, that this was a remote forest, that in darkest Africa, where this really extraordinary and surprising thing happened because of the strange dietary preferences of the population. In fact, that's not true at all. It would have taken, 100,000 bushmeat incidents to create the Ebola epidemic that we saw. That wasn't what was happening. It was just a limited small number that multiplied because of the conditions. And part of the vulnerability was that Guinea and its forests were entirely brought into the world economy and interconnectedness that we've been talking about, that the forests were filled with paths and roads, and loggers went in, and miners went in, and they were also planting palm oil trees, and great plantations were taking place. So the last thing that this was an isolated corner of the world. There are no more isolated corners, and this supposed isolated corner is not any more than the forests in the Congo or in Brazil are isolated from the rest of the world. The forests are being progressively destroyed with terrible results on the climate. And climate too, we can talk more about that, has immediate and devastating health implications apart from the ones we've discussed, but it clearly does lead to a falsification of the relations of human beings with the other species that inhabit our planet. And that's where we now have an extraordinary risk. Bats now there's nothing wrong with the bat, and bats are not attacking human beings. And it makes me really anxious when I hear that some people think we ought to start culling the bat population. It's not that. The bat is innocent and not dangerous. It's what we do in the world that the bat lives in. That's where the problem emerges, and that's where spillover occurs. And we're at fault, not the bat.
Right, thank you.
Thank you, Helen. Let's turn over to some of the audience questions, and if we have time, we might be able to jump back in. And again, if anybody that has questions, feel free to type it out in the chat box in the bottom of your Zoom screen, and we'll try to get through as many as we can. We have a question from Richard Song. He asks, why are pandemics underplayed in teaching history? And he gives the example of the plague of Athens during the siege of Athens in the Peloponnesian War, the fall of the Pax Romana, as well as the plagues in the so-called New World during the conquests. So just to name a few. So why are pandemics underplayed throughout the teaching of history?
I'm delighted with this question, and it's one of the issues to which I've been devoting the last few decades, which is to try to recapture health and epidemic disease as major features in the way that our world has evolved, and to see them as just as important as revolutions, economic crises, and wars, and indeed as often triggering or stymieing or determining the outcome of those other crises. I'm not trying to be now a sort of disease determinist. I'm not trying to say that we can reduce disease to, that is history, to understanding disease. What I'm saying is different. It is that we can't understand history without including disease as a major feature of that process. And a major part, it's not just history, it's also our future. That unless we include these diseases and how we think about that future, then we're going to have more calamities such as we're living through in 2020, 2021. And that is unnecessary, and we're not doomed to have that happen. Everything I'm saying is not meant to be a sense of doom. Oh no, where the cataclysm is arriving. No, I'm saying we have choices. That doesn't have to happen. We can take charge of these processes. We can be imaginative and innovative. Why the question, there's this sort of despairing question, part of the question, why hasn't this happened in the past? I think part of it is the way history emerged as a discipline, which was, I'm now thinking in the early modern and modern world. I'm not going back to Thucydides, who didn't have this problem, and his history of the Peloponnesian War is wonderful and is entirely naturalistic and could be written by a modern historian. What I'm thinking about is, let us say, the reemergence of history, particularly in the 19th century, where it was considered lessons for the teaching of leaders. And so it was about the moral instruction of how, and I'm afraid the leaders were almost always thought of as men. And so it was also quite a misogynistic way of teaching history, how great men are made and produced, and what sort of moral choices they might have to make. Also because there was a kind of, I'm sorry to say, sense of certain activities that human beings engage in as being heroic and needing to be celebrated. And war was one of those. And so there was something, I mean, it strikes me extraordinary, for example, that the person in the 19th century of all the people who's been most written about, more books have been written about Napoleon Bonaparte than any other person in the 19th century. And there is a kind of what he did and I do write about this. So that's one reason I feel particularly engaged with the issue.
Well, if Professor Deborah Davis doesn't mind, I'm curious as to whether you've tracked this through your sociological perspective, and what your reflections are, comments are on the conversation with Professor Snowden so far.
I just wanted to say that I'm back again, by the way.
Oh, great.
Welcome back.
Thank you.
Great. So we still have a couple questions, and let's see if we can try to get through a couple more. Charlie here rose his hand, so I'm going to unmute him and have him ask the question directly.
Yes, sir. I can't say that I'm very knowledgeable, but I'd like to ask you to compare the eradication of smallpox with how we plan to treat the coronavirus.
I heard your question, and that's a big one, and I'll try to answer as best I can. A first thing is that with the polio virus, when the eradication program began, there was an understanding of what the vaccine was actually capable of doing and how to deliver it around the world. And there was an organization created to do that. And before a world vaccination campaign began, there had been national on a smaller scale. And polio happens like smallpox. Smallpox in particular was an exception because it was there is no natural reservoir, animal reservoir for the smallpox vaccine. So if you do eradicate it, then it really is gone, and it is so florid in its symptoms that it's easy to know where smallpox is. These features don't apply at the moment to the coronavirus. And I think we're very ill-advised to use that word eradication at all to deal with it. We have no justifiable scientific reason for thinking that we're capable at this point of eradicating the coronavirus. There is a very huge animal reservoir of the coronavirus. It has every possibility of reemerging in that way, even if we do successfully contain it. And I think we need to be careful about how we teach the public about what this vaccine can and can't do. There was a beautiful metaphor that Michael Ryan, one of the directors of the WHO, used. And he said, one of the things we don't want to do is to teach that the vaccine is like a magic unicorn that with one horn can solve every problem. He said, in fact, the way to understand it is that it's one tool in a toolbox, and that in order to contain and get on top of this pandemic, we'll need to continue practicing other tools of public health, hand washing, social distancing, and all the rest of it for a considerable time into the future. And we don't know, for example, whether just to give some reservations about the vaccine. I'm a great fan of the vaccine, by the way. This is one of the silver linings of the pandemic, an extraordinary scientific achievement, partly done through international cooperation and the sharing of the genome. So it's a wonderful thing to have this vaccine. I'm glad and I hope it's rolled out quickly. But what worries me is so often one sees presented in the media, the idea that this is the end of it. We have the vaccine, it's over. And we have a technological quick fix. Whereas what we have is an extraordinarily deep societal problem, societal, economic, environmental, and that needs to be addressed in very innovative and imaginative ways. and will be very misguided if we rely only on the vaccine, particularly when we don't actually know exactly what we're getting. We don't know whether the immunity that it provides will be long-lasting, or will it be only partial. And what's happened is that we know that certain people, when they've been recovered from COVID-19, a certain number of people, nobody knows how many, but there are some who've been reinfected with COVID-19. In other words, their immunity waned. And so someone like me, I would never say that because I had COVID-19, I'm immune to it. I have no way to know that. There's no scientific data to demonstrate that to anyone. And similarly, when vaccine efficacy is brought into view, it's not the same thing as talking about its immunogenicity. In other words, we know that it's effective, but effective dealing with what? With someone with a mild case, a severe case, a child, a very frail elderly person. We don't know whether the vaccine, because naturally you wouldn't expect that when you have volunteers for testing, you don't pick small school children. And you don't go into nursing homes and ask them to be the volunteer and this scientific experiment. The result is that there aren't the data yet. And so I think we mustn't make too many leaps of imagination. We're all so desperate to emerge from this dark period in which we're living. That's human nature. We all feel that way, but we're not doing ourselves a favor by blinding our eyes and closing them to the reality and not continuing to ask the questions about how did we get here and how can we get out of this and what do we really need to do, and make use of this wonderful new tool, but don't think of it as a panacea. And I think we're a long, long way from ever talking about eradicating COVID-19.
Yes, that's a great warning that we're still in it for a while, and so it's not time to let up yet. Maybe another question or two, and then we'll wrap up. Stephen Upgrove here asks, building on your analogy of the Caribbean and the hurricanes, for decades, Cuba suffered few, if any, deaths from hurricanes because evacuation orders were strictly obeyed and forced, while elsewhere, including the US, significant loss of life was common. So it seems that it's inevitable that there is a price for more democratic societies to pay in terms of natural disasters like storms and epidemics for the freedoms that they otherwise so value. Would you agree with an assessment like that?
I would agree with what was just said about Cuba and its preparation. And that's another country, not only with regard to hurricanes, but also with COVID-19. So that I'm in total agreement with half of the statement. The other half, however, I'm unable to agree with at all. I don't think that autocracies are better able to deal with medical crises and preparation than democracies. In fact, I rather think the opposite. And we have a number of democratic countries that have dealt very well with COVID-19. And I was talking about New Zealand is a good example. Similarly, I talked about Senegal, and even, I won't talk about the democracy of Rwanda particularly, but clearly South Korea is an example. And it's not the case that autocracies have, and I don't think, for example, if one talked about what's happening in a semi-autocracy like Brazil as a good response. And I don't think that the Russian handling of this emergency has been something that we really want to imitate, nor Hungary, which has now used the epidemic as an excuse for a grab of power and to create a more autocratic regime, and has not dealt well at all with COVID-19. So no, I don't think that the evidence suggests that autocracies have some magic way of dealing with these. And in fact, these crises, and in fact, the evidence would seem to me to suggest that what you need is to mobilize innovation, cooperation, collaboration, in order to fight these pandemics. So I'm a great believer in solidarity, and that is a democratic process. And I would also say I'm a believer in science, and I think science is one of the most democratic of human endeavors, because it means that what you do, you are not claiming your authority for its truth, any assertion you make. You're claiming that anyone else who follows the same steps that I've taken will come up with the same result. Has nothing to do with me, and they're free to follow it and test it. And that's how scientific advance occurs. And an autocratic regime inserts contingency and personality and cult of personality, and is usually incompatible with the appliance of real scientific principles. So I think our hope lies more in mobilizing people and to collaborate and to innovate and to think together.
Fantastic. And I think that transitions into the last question that I think I'll ask, which is a little more forward-looking, which is, I think, one of the things that I was fascinated about throughout this conversation, and having looked at your course again, is that there's the immediate impact of the epidemic in terms of morbidity, mortality, even like the economic impact. But often what we overlook is the long-term impact of epidemics. And that's seen through intellectual, social, artistic, other realms. And so I guess the question now is, having gone through COVID-19 and still going through COVID-19, what are the potential long-lasting, long-term consequences that you see from COVID-19 in regards to maybe infrastructure, city planning, healthcare systems, how we think about work, education, values, how we think about globalization? I mean, what are the bigger picture consequences of this pandemic outside of just the deaths and the economic toll, which obviously is great?
How many days do I have to answer? No. No, that's a beautiful question. And it is, however, let's recognize, an enormous one. And it also means that I'm going to have to take off my hat as a historian a bit and get out my tea leaves and crystal ball and try to look into the future. But
I made the mistake that we all historians don't want people to ask. But
No, but it's fair. I have to think, as a citizen like everyone else. And so let me answer on that basis. This is not me as a historian, it's me as a citizen who's worried about these problems. And in that guise, I would certainly say that let's look at some of the things that are actually happening already, and around so that we have actual reasons to think that this really may happen. And one I've talked about, a silver lining, being the way in which these epidemics often elicit enormous innovation and new ideas. And we've seen this in the development of the vaccine. That's one example, clearly, in the genome being so rapidly decoded. What I wanted to add is that now we're also seeing the emergence of the reimagining of cities and the life that goes on in them, but in actual real places. There's a movement called the 15-minute city, which is now being thought about in Milan, in Madrid, in Buenos Aires, and Paris, and even in London. And the idea is that in order to make, not to rely only on a vaccine, but to realize that something more fundamental is happening here, and that we need to reform the way in which we live our lives in cities. Cities are one of the, if I could say, a super spreader features of a pandemic like this, and therefore cities need to be made safer. And the idea of the 15-minute city is that urban planners are thinking about ways in which to make cities decentralized so that people who live in them within a 15-minute walk of where they live will find everything they need. Not that they'll ever be forbidden to go wherever they like, but within a 15-minute radius, so they won't have to get into a car, won't have to go on a crowded bus or subway. They'll be able to find work, shopping, recreation, cultural activities, exercise, green grass. All of that should be available to every inhabitant of a city within 15 minutes. And that's leading to ideas that with the cities, part of the problem, of course, is the automobile. And think of the environmental greenhouse gases that are generated by asphalt, to which such huge parts of 50% of many city centers are given over to asphalt, streets, driveways, roofs of buildings, and all the rest of it. And that's generating enormous greenhouse gases, in fact, more than the emissions of the automobile. And so that needs to be rethought. And these cities are thinking about really sort of exiling from the center the automobile entirely, and creating broad spaces where people can practice social distancing, where they can socialize outdoors, where there can be cultural activities outdoors, where they can pass each other in the street without bumping into each other, that all of these things can be, and they can lead their lives without generating lots of greenhouse gas that's going to come back to haunt us, and lots of health and other related ways. And so urban city planning and reimagining cities is something that's really going on right now. And some of the really creative minds in Europe and lots of different countries are actually rethinking cities and how do we live in them. And that has huge implications for work. How do we work? How do we find recreation? How do we play? How do we exercise? How do we go to school? All of those things are being, there's a lot of churning going on around the world in people's minds. So unlike the question about an autocracy, I would say if anyone comes to you and says, I have a blueprint from the future, I think I would say to you to run as far and fast from that person as you can. And what needs to happen is to bring human innovation together, starting and having it percolate from the bottom up. And that's what will perhaps enable us really to have the most new ideas, and also the most broadest acceptance of the ideas that emerge. And I think that conversations like this are part of that process. And I hope that lots of them will be going on all around the world. So that's another thing that I hope will happen.
Wonderful. Well, thank you so much for a fascinating talk. I'm sure everybody's already clapping. I haven't even asked everybody to clap yet. So thank you so much for taking the time to do this. And thank you everybody for staying on and asking such great questions. I'm actually going to unmute everybody so that you guys can thank Professor Snowden personally. And we also have
very kind. Thank you extremely much. And I've really loved the questions and the chance to talk with you. And as I've said, I'm really committed to this. I think we all need to put our heads together. That's the solution. It's not a magic bullet.